Smoker's leg, causes and symptoms. Excessive smoking can lead to smoker's leg. In this circulatory disease, blood vessels narrow and restrict blood flow to the lower limbs. In people with smoker's leg, blood flow reduction may cause leg pain or cramps when walking. The treatment options for smoker's leg may include lifestyle changes, prescription medications, and in severe cases, surgery. In this video, we discuss the causes of smoker's leg. We also look at how to treat and prevent the condition. What is smoker's leg? Smoker's leg refers to symptoms in the leg resulting from a condition that doctors call peripheral artery disease or PAD. PAD causes narrowing of the blood vessels, which reduces blood flow to the arteries in the leg. It can also affect blood flow to the arms, stomach, brain. According to the Centers for Disease Control and Prevention (CDC), more than 6.5 million people in the United States aged 40 years and above have PAD. PAD is more common in African Americans than in people belonging to other racial groups. PAD most often due to atherosclerosis, a buildup of plaque in the arteries which restricts blood flow outside the heart. When a person develops smoker's leg, they are likely to experience pain in the legs when walking. This symptom occurs due to insufficient blood in the limbs. Causes of smoker's leg. The most common cause of PAD is atherosclerosis. Atherosclerosis occurs when fatty deposits build up inside the arteries, restricting blood flow to other parts of the body. Blood clots may also form on the artery walls, decreasing the size of these blood vessels and sometimes blocking them. Although doctors often consider atherosclerosis to be a heart-related issue, symptoms can occur throughout the body, including in the legs. Other factors that may increase the chances of developing smoker's leg include smoking, being over the age of 60 years, having overweight or obesity, diabetes, high blood pressure, high cholesterol, a family history of peripheral artery disease, heart disease, or stroke, chronic kidney disease, or being on dialysis. Symptoms. Many people with smoker's leg experience no signs or symptoms. However, some people may have leg pain when walking, which the medical community refers to as claudication. The severity of claudication ranges from mild to severe. The most common symptom of peripheral artery disease is muscle pain or cramping when walking, especially in the buttocks, hips, thighs, calves. Walking may trigger the symptoms, which usually disappear a few minutes after resting. Other symptoms may include leg weakness, hair loss on the feet and legs, coldness in the lower legs or feet, sore feet, toes or legs, discoloration of the legs, shiny, pale skin on the legs, which may appear bluish in some people, toenails growing slowly, decreased or absent pulse in the feet, erectile dysfunction. Treatment. The treatment for smoker's leg typically involves lifestyle changes and medications. These treatments help manage symptoms and stop the aggravation of atherosclerosis. Lifestyle changes. People can adopt certain measures to help reduce the symptoms of smoker's leg. This include engaging in regular physical activity. A doctor may recommend regular physical activity under a supervised trainer. Leg exercises, walking regimens, and treadmill exercise programs may decrease symptoms. Stopping smoking. Cigarette smoking is the most common risk factor for peripheral artery disease. Quitting smoking may help slow the progression of peripheral artery disease and reduce the risk of complications. Reaching or maintaining a moderate body weight. People with overweight or obesity have an increased chance of developing smoker's leg. Eating a balanced diet. Many people with peripheral artery disease have high cholesterol levels. Eating a balanced diet that is low in cholesterol and trans fats and rich in vegetables and fruits can help lower cholesterol levels in the blood. Avoiding certain cold medications. Over-the-counter medications containing the decongestant pseudoephedrine constrict blood vessels, which may worsen symptoms. Angioplasty and vascular surgery. If routine changes and medications do not work, a doctor may recommend angioplasty, stenting, or vascular bypass surgery. Angioplasty involves inflating a balloon across the narrowing to increase the size of the decreased artery. In doing this, it helps increase blood flow throughout the body. Stenting involves placing a hollow metal tube into the affected artery and deploying it across the narrowing to unblock the artery. Vascular bypass surgery involves reconnecting blood vessels to redirect blood flow from one area to another. Surgeons use this technique to allow blood to pass around a blockage. Prevention. A person can help reduce the risk of developing smoker's leg by quitting smoking, maintaining a moderate weight, eating a balanced diet, exercising regularly, managing blood pressure and blood sugar levels. When to contact a doctor. Lifestyle changes and medications often help treat and prevent smoker's leg. However, some symptoms may require immediate medical intervention. A person should see a doctor immediately if they have leg pain or numbness when walking, pale or discolored limbs that have a very weak or absent pulse, peripheral artery disease symptoms, and are over the age of 50 years with a history of smoking or diabetes.